Hi everyone, I'm Dr. Krithika Ganesh. I'm a family medicine specialist practicing in Bangalore. So today I wanted to talk to you about the right method of using an inhaler or a metered dose inhaler as we call it. So these are used by people who have asthma or COPD or even some people with allergic bronchitis. What I have noticed in my practice is a lot of patients are prescribed medicines through a meter dose inhaler and have been using it for a while, but their asthma symptoms are not controlled. When I actually sit with them and ask them to demonstrate how exactly they are using it, I realize that they are not using it properly. And most of the medicine is just escaping out from the sides into the atmosphere and not really reaching their lung. And that's probably the reason why their symptoms are not controlled. Just explaining to them and guiding them in the right way helps a lot of times to improve their symptoms with the same medicines that they are already taking. So I thought I'll make this video to help others who might be in a similar situation. So basically, this is a meter dose inhaler. So they come in different colors and sizes based on your medicine and the company. But the mechanism is the same for all of them. So they generally have an outside, jacket, which is a plastic jacket with a lid which can be opened and it clicks shut. The inside, this is the canister which actually contains the medicine. The medicine is mixed with a propellant sort of chemical which functions somewhat like a deodorant. So basically, when you press it, it aerosolizes the medicine and delivers it into your mouth. Some of the inhalers also come with this counting window. So basically, the total number of puffs that can be delivered is displayed initially, and as you keep using the puffs, the number keeps reducing. So that way you will come to know when it gets over and when it is going to get over, and you can replace the inside canister alone. You don't have to buy the whole thing again. So let me show you how this is used. So this is used in two ways. You can either directly use this by placing this in your mouth and directly use it, or you can use it with something called a spacer device. So I'll be talking about both methods today. So basically what you do is, first of all, when you buy a meter dose inhaler for the first time, you will need to do something called priming. So priming is basically mixing the medicine and the propellant chemical inside well, so that with each puff the right amount of medicine is dispensed. So priming is very simple. So basically you take the inhaler, you just shake it very well, face it away from you, and just give 2 puffs, and then you can that is what is priming. You can start using it normally after that. So this priming you need to do even if you've not used your inhaler for many days, say 20 days or a month or more than that, and it's just been lying around. You may have to do this priming step again. So once you've done that, the next thing is, you've already shaken it. The next thing is the right way of placing it in your mouth. So make sure that your lips are completely sealed around this opening, like this. So you see that there is no gap on the side where the puff can or the medicine can, escape. Most of the times I see people making the common mistake in this step itself. So basically what they do is they either bite on it like this, or they just keep it just near their mouth like this, or they just put their lips on it, but it's very loose seal like this. So on the sides the medicine just escapes. So don't do that. Make sure that it is completely in your mouth and it is sealed at the corner of your lips. Once you've done that, before you do that, before you put it in your mouth, you need to take a deep breath and completely exhale like this. Once you've finished exhaling, put it in your mouth with the correct seal. Then you press down on the canister so that you can hear the audible puff. As you press down, coordinate your in breathing at the same time or inhalation at the same time, like this. Once you've inhaled, make sure that you're keeping the device, continuing to keep the device in your mouth, and you hold your breath in for 10 seconds, like then you remove it from your mouth and exhale. So let me just do this whole thing again at a stretch so you get a better idea, and then we will recap the steps. Make sure you keep it closed again. So recapping the steps again. So you hold it like this with your thumb at the bottom and the two fingers on top. Shake it well. Take a deep breath. Leave out. Exhale completely. Then put this in your mouth with the lips properly sealed. As you press down the canister, you inhale at the same time. Continue keeping the device in your mouth and hold your breath for 10 seconds. Remove the device and exhale. Now, sometimes what happens is you're actually having an ongoing asthma attack. You're feeling breathless and you're going to use an inhaler which is meant to be used in an emergency situation like that. In that time, you may not be able to hold your breath in for 10 seconds. So it's all right. Just hold it in for as long as it is comfortable and make sure your lip is sealed and the other steps are followed correctly. So now this method of using it directly from the inhaler itself may not be possible for some people. For example, children, because it's difficult for them to coordinate the inhaling at the correct time that you press down the canister. Also for very old people who might have some shaky hands, or who might be a little disoriented, or who are anxious about using the inhaler. Also people who are new to this, who have never used the inhaler before, for them also this mastering this technique of correctly inhaling at the same time that you press down and holding it in, and that whole those few steps, they might find it difficult. For those kind of people, you can use something called a spacer. So the spacer is basically something which it's like a chamber which creates a kind of space between the inhaler and your mouth. So it has an opening here to fit your inhaler in, and it has this opening which is somewhat similar to the opening of the inhaler itself, which you put into your mouth. So the one that I have here is transparent, and it comes with a valve. You do get other ones which are opaque, where you cannot see inside, and they may not have the valve, but it's the same mechanism. So in this, what you can do is you don't have to coordinate your breathing in along with the same time that you press down the canister. You can keep it in your mouth, and after you press down the canister, just breathe in, breathe out. Breathe in, breathe out through your mouth itself into the chamber itself. Basically what happens here is the medicine which is propelled out through the inhaler, right? It continues to remain in this chamber, being available to you for a longer time. So with every breath that you take in and leave out, take in and leave out, little by little, the medicine ultimately enters into your lung. So this is a great way of, ensuring right medicine dispensing for people who are new to using it, who are anxious, who are old, as well as children. So I hope you have found this video useful. I'll see you again with the next video. Bye.